So the next muscle that we're going to look at in our how-to series is the muscle Latissimus Dorsi. Now, Latissimus Dorsi is a muscle that connects the arm all the way down to the lowest part of the back, the iliac crest. Okay. It's the widest muscle in the lumbar part of the back. In fact, the widest muscle in the human body. But it's also surprisingly thin in the lower back and covers almost all the other back muscles except for where trapezius is dominant in the upper part of the back. Its origin is the spinous processes from T7 to T12, the thoracolumbar fascia, the iliac crest, and also the inferior 3 or 4 ribs actually have part of the origin. Its insertion comes up through here, inserts into the inferior angle of the scapula, and then continues on into the bicipital groove of the humerus. Its actions are many. The most obvious one is the internal rotation or depression of the shoulder. So you bring the shoulder down. You can see the muscle tenses through here, and you can also see the muscle flatten in the lower part of the back. You can see it slightly here. But it also aids rotation. That's stretching the muscle, so then bringing the muscle through this way, concentric contraction, and also aids in adducting the scapula, amongst many things. It is also a stabilizer for the spine in many movements. If we now look at the hydrotherm related movements that are connected to the area that includes Latissimus Dorsi. So we're really looking from the lowest part of the back, just across the iliac crest, right the way up to past the inferior angle of the scapula and round and into the bicipital groove of the humerus. We can see that hydrotherm gives us a unique access with our client lying face up. The access in the lower back is one of my favourite parts of hydrotherm because the lower back is supported with the knee being bent, the pelvis is tilted, the hip flexors effect on this part of the body is minimised, but I can still get access, in fact, right the way across to the other side of the back. I can tilt the pelvis, which again allows me to relax the muscle tension in this area more effectively. I can follow with really lovely fluid movements, like a flat effleurage. I can also use deeper pressure. I'm changing my body position slightly so that you can see what my hands are doing. So I can cut my hands this way. I can also use knuckles into the lower part of the back. If I come to this side, I can bring the client's arm above the head and I can do some amazing effleurages. This is called the large sweeping effleurages. I can also do movements to lengthen through the top of the insertion of Latissimus Dorsi and come right the way down into the lower back. So where the thinness of this muscle in the lower back causes tension and issues, we can really release the effects of those things. My clients with lower back issues are often the ones who comment most about the benefit of hydrotherm. That also is a benefit which, if clients are laying on the bed for a long period of time, might be having facial work and then having full body massage and even having treatments on their feet, they can be in this position for an extended period of time because you've got this constant movement which allows the body to not get stiff, to not get achy, and equally the client's not trying to take pressure off other parts of their body because those are not being compromised by gravity. So hydrotherm is a fantastic way of working on this muscle. If I now look at the holistic interpretation of Latissimus Dorsi. Latissimus Dorsi links the line at the lower part of the back, which relates to completion and fulfillment, and then the area immediately above it, which connects to the sacral chakra, which is to do with satisfaction, wants and needs, and those relationships. This muscle, because it's on the back of the body, looks at the relationship that we have with ourself. So how do we feel about our wants and our needs? Okay, do we feel that we are fulfilled in the moment? But it also links those concerns up into the shoulder and into the arm, which means it brings the concerns together of whether what we are doing, the pressure we're putting on ourselves and the effort we're putting on ourselves, which is held up here, is that providing us the level of satisfaction, the level of fulfillment that we're looking for in life. Often tension along this muscle is literally about can I fulfill what I want to fulfill? That can be connected to can I fulfill what others are demanding of me? But actually most of the pressure that causes tension in the lower back is coming from tension of our own expectation, our own pressure that we place on ourselves, which brings the shoulders forward. Okay? So if you want clients to be aware that they're putting pressure on themselves and help them to release it, bringing the shoulders back into this neutral position, which also shortens, in other words, brings the insertion and the origin of Latissimus Dorsi closer together. That means that what we're getting the client to do is to take pressure off themselves from having to finish anything, to fulfill on anything, to please anyone before they are allowed to relax, to enjoy what's happening, and to be in the moment and just benefit from the right now. Okay. So from a holistic point of view, having the client in this position actually allows those two considerations, the consideration of effort and action and the consideration of fulfillment and satisfaction, to actually be able to be separated from each other, so I don't have to try to relax. I don't have to please anyone first before I can be pleased or happy.